Very good morning, doctors. So, welcome to one more PYT, previous year topics of medicine, Inicet. So, this one of the doctor has asked me this term, what is meant by this term. So, I want to discuss regarding MCQ, what is meant by the term. Okay. So, prosopagnosia, right? Prosopagnosia is associated with the lesion of which one? Cingulate cortex gyrus, posterior parietal cortex, hippocampus, amygdala and entorhinal cortex, or fusiform gyrus and lingual gyrus. Now, in which of these regions, if there is an occurrence of lesion, it may lead to prosopagnosia. What is your answer? Just think for 5 seconds. Just drop it down in the comment section, right? Now, first of all, yes, just make sure that you first fix your answer. Then I will start the explanation. I think your 5 seconds is completed, everyone. Okay, shall we start the answer? Okay. So, what actually is meant by prosopagnosia? What actually is meant by prosopagnosia? It is, okay, we don't discuss here, we'll go to a new page, fresh page. So what is meant by prosopagnosia? See, doctors, if you know the definition, fine, that is good, but I am writing this for the doctors who really want to revise the session. Okay, so don't think like why Sar is telling all these things. No, I want all of you people to revise it, to recognize the known person's face, right? For example, previously this guy know him, but after a couple of years the patient is unable to recognize a known person. He knew that person, but he is unable to recognize the face. Now, why this condition prevails, we will just check what actually this condition is, right? So, you take the perceptual information. Perceptual information is something which we perceive through the senses. You take it visual, you take it auditory, you take smell, you take any other thing. So, which we perceive through the special senses. The perceptual information which our brain actually takes. But if you take particularly regarding the faces and objects, right? The perceptual information about the faces and objects is generally encoded by, always remember, primary striatal cortex. Sorry, it's not striatal. Primary, that is nothing but striatal, that is primary visual cortex. I am sorry, primary, that is nothing but striatal visual cortex, right? And also sometimes you should remember this one also, and also the adjacent peristriata, that's why it is called as adjacent, because it is given with the name peristriata visual association cortex. But in these two, if you ask me, primary visual cortex is the main region which helps in perception of the faces and objects of a known entity, right? Now, this information is subsequently relayed first to the downstream visual association areas of occipitofrontal cortex. Guys, listen carefully. If you miss any of that statement, everything collapses. And from here, then it will be going on to other heteromodal, or you can say like paralimbic areas of the cortex or cerebral cortex. Okay, now this is the flow actually, right? So it is actually the just remember, at least remember this statement, the perception of the faces and the known objects and their entities are generally done by the primary visual cortex. They collect the information and they will just go on with the downstream regarding the visual association areas of occipitofrontal cortex. From there it will be going to the heteromodalities or paralimbal areas of the cerebral cortex. Now, for example, if there is a bilateral lesion, remember carefully. Now, this is the point that you should remember. Just 1 minute. So I have a problem with my point. Okay. Now, if there is a lesion, if there is a bilateral lesion present in the fusiform and the lingual gyri of the occipitofrontal cortex, gyri of occipitofrontal cortex. For example, we will think like this. What will happen? Now they will disrupt the complete process. The complete process, which we studied here, which we explained, the complete process. This process will be completely disrupted if there is any lesion in the fusiform and lingual gyri of occipitofrontal cortex. Now, so the complete process will be disrupted, right? Now there will be completely disturbance in this pathway, and this may lead to inability or problem in the recognition of known faces and objects. Now this condition is called prosopagnosia. Okay. Now, if you ask me one thing, the patients with prosopagnosia, they cannot recognize the familiar faces. Remember this. See, for example, if I don't know some X person, actually I have never seen, I have never communicated with him, I have never actually thought of that person. Now, can I knew that person personally? Obviously, if you bring that person in front of me and if you ask me, sir, recognize this person, can I recognize him? No, it is nonsense. So, prosopagnosia means the patients are unable to recognize the familiar faces. Now, sometimes the prosopagnosia is very severe that they can't even recognize the faces of their family members, as well as sometimes his face also he cannot recognize, the oneself, his face also he cannot recognize. So that is the severity of prosopagnosia. So for example, if he sees himself in the mirror, his reflection also he cannot recognize. So that is the severity of lesions if they are present in the fusiform and lingual gyri of the occipitofrontal cortex. Now, the resultant face and object recognition deficits, which we see here, they are actually denoted as prosopagnosia, and also sometimes they are also called visual object agnosia. Okay. Now, this is not actually a perceptual defect, right? So just remember this. It is actually not a perceptual deficit, since what happens is the prosopagnotic patients, which we actually come through, they can easily tell whether two faces are identical or not. They can easily tell whether two faces are identical or not. So that capacity these patients will have, but they cannot recognize. They can tell the difference, but they cannot recognize. Now furthermore, I will add one more fact. A prosopagnostic patient who cannot recognize a familiar face by visual perception, he cannot recognize visually a person's face. Recognize visually a person's face. But this is important, this statement, but he can use the auditory clues to reach the appropriate person. So he can recognize the person with the help of auditory information that is generated in the brain. See, only his visual calculatory part in the brain is affected with the lesion, but not the auditory information pathway, right? Only his visual calculating pathway has been affected, but his auditory information calculation pathway is intact. So he can recognize the patient with the help of auditory information. Okay, with the help of auditory information. If the person's voice is if the person's voice is made to listen to him. Okay, so that is all about prosopagnosia. Now if you just again come to the question, prosopagnosia is associated with lesion of, what is the answer? The answer is, everyone please tell me the answer. It is the fusiform gyrus and lingual gyrus. Now some of the doctors are asking, sir, this question I think it is out of the topic, sir. Who said it is present in Harrison man? You go and check. I read all the 6 previous editions of Harrison, so please don't tell this to me, right? It is present in the Harrison. If you ask me even the page numbers also, I will tell, because sometimes I have a habit of writing the page numbers, the topics also, right? It is something like in the 200 pages. You go and check in 200, 250 type in the, I will at the 18th edition actually. So you can just go and check. Okay. So prosopagnosia is associated with the lesion of fusiform gyrus and lingual gyrus. Okay. Okay, doctors. Thank you. We will meet up with one more new topic. Thank you.